The patient needs to expose both lower legs, including the knee and foot, as you will need to examine both sides. Observe the gait of the patient whilst they are walking into the examination room. Note the angle and use of the ankle and foot of the affected limb whilst walking. Observe generally for swellings, wounds, cellulitis, colour of the skin, calluses or deformity of the foot or toes. Observe the lower leg from the posterior aspect. Look at the calf muscles and also the shape of the heel for valgus and varus deformity of the subtalar joint. Feel for heat from the ankle or toe joints. Palpate the lower leg, starting at the head of the fibula, down along the shaft of the tibia, the posterior aspect of the lateral and medial malleoli, calcaneum, the midfoot, base of fifth metatarsal, the rest of the metatarsals, and the phalanges. Check distal pulses and capillary refill. The distal pulse checked will be the dorsalis pedis pulse on the surface of the foot. Capillary refill is checked by applying pressure to the nail bed until it turns white, then releasing. The tissue should return to a pink colour within 2 seconds. Sensation is also checked distal to the injury by light touch. Finally, the posterior aspect of the lower leg is assessed. This includes the gastrocnemius and Achilles tendon. Palpate the muscle to see if it is soft and non-tender. Check for any steps or irregularities. Feel the Achilles tendon for any gaps, swelling or tenderness. Plantar flexion. The patient pulls the foot downwards. Dorsiflexion. The patient pulls the foot upwards. Inversion. The patient inverts the foot and ankle medially. Eversion. The patient moves the ankle and foot laterally whilst maintaining the tibia in a neutral position. Resisted dorsiflexion. Ask the patient to dorsiflex their ankle whilst you provide resistance. Resisted inversion. Stabilising the tibia with one hand, with pressure on the foot in the direction of plantar flexion and eversion. Ask the patient to move the foot into inversion and dorsiflexion. Resisted eversion. Stabilising the tibia with one hand, you apply pressure on the foot in the direction of dorsiflexion and inversion. Then ask the patient to move the foot into eversion and plantar flexion. Anterior draw test. With the patient seated and the foot in slight plantar flexion, you hold the back of the heel and stabilise the distal tibia with the other hand, attempting to draw the foot anterior to the tibia. Excessive movement anteriorly indicates instability of the anterior talofibular ligament. Resisted plantar flexion. With the patient stood up, Ask them to rise onto their toes, causing plantar flexion. The patient's weight provides the resistance for this movement. Finally, perform the Simmons test. Squeeze the calf and the foot should plantar flex. This test is positive if the foot fails to move, indicating an Achilles tendon rupture.